to our last session for the day, The Way Forward. Before I start, I want to say how excited we were and are that you joined us for the 6th Annual Health Philanthropy Summit. And once again, we're quite pleased with this educational opportunity for our health-giving client community and all the healthcare fundraising professionals in partnership with the Ohio Association for Healthcare Philanthropy. We really thank you for engaging with us today. These aren't the ideal circumstances. We'd love to be gathered together, but this virtual presentation, we think it worked well today, so thank you. And again, thank you to our partners, the Ohio Association for Healthcare Philanthropy, who have been with us since the beginning in producing an educational day like today. Today I want to talk about the way forward, finding calm in this sluggish pandemic recovery, and a few ways to cope with stress and anxiety as we find ourselves still fighting the coronavirus. Keep Calm and Carry On was a motivational poster produced by the British government in 1939 in preparation for World War II. The poster was intended to raise the morale of the British public, threatened with widely predicted mass air attacks on major cities. The basic phrase, carry on, means to continue, but here it specifically means to persevere, and it's often associated with the British stiff upper lip. It seems to evoke the Victorian belief in British stoicism and self-discipline and fortitude and remaining calm in adversity. The Keep Calm poster has been recognized around the world and now commonly is featured on posters and clothing, novelty items, and even internet memes. It has become a popular slogan calling for persistence in the face of challenge, just like the people of London and Great Britain during the bombings in World War II. So here we are, December 3rd, 2020. Some healthcare fundraising offices are open. Some are still requiring their staff to stay at home. Some people are panicked that we're moving way too fast. And some are concerned we're moving too slow and causing real harm to our U.S. economy or to our nonprofit hospitals, assisted living centers, memory care and nursing homes, home care and hospice agencies, or other settings on the front lines of healthcare and medical services. When fear, anxiety, and even confusion are about what's right to do, and the confusion and the fear is high, we need good practical solutions to reduce stress. We need to keep calm and to carry on. So how can we be calmer, find mental peace, find a new way forward, and find sanity in the midst of what might be a long looming public health crisis? Allow me to share a few time-tested, keeping on, mindset shifting activities. The first one, keep on letting go of the illusion of control. A recent article in Inc. magazine by Nate Klemp talked about this philosophy. Fear sparks a deep desire to be in control, but in this case, that is nearly impossible. And so we all do sorts of strange things that make us feel we have some control over things, like obsessively tracking the news or gathering toilet paper or ruminating on what we're hearing constantly in our minds. Ironically, most ancient wisdom traditions argue that inner peace comes not from control, but from letting go. When we acknowledge that the fluctuation of the market, the timing of the next recession, the slow or no response from donors, or the spread of the coronavirus is out of our control, we let go of our subconscious need to control it, to control the environment. We feel a bit more at peace. So let go of the illusion of control. Everyone's stressed right now. And if you ask them why they're stressed, they'll tell you it's because of the virus. But that's not the full story for most of us. Most of us are not actually suffering from the virus here, or have we? And most of us are doing pretty okay. What people are actually stressing about is the uncertainty of the future. Uncertainty about fundraising and its future, uncertainty about bills and budgets, uncertainty about the safety and security of their loved ones, uncertainty if the government will do the right thing, uncertainty that things won't really get better. The primary driver here is stress. It's not the virus itself, but uncertainty about its future effects. The most reliable way to deal with this kind of stress is the same it's always been. Figure out what we can control and relinquish attempts to control everything else. What can you control right now? Let go of everything else. Keep being comfortable with reaching out to prospects and donors. Stop being overly anxious about how you'll be perceived. Empathy is a huge part of fundraising. You need to build trust and establish rapport in order to fundraise, even in normal circumstances. So being extra empathetic during a crisis seems to be the natural way to proceed, right? This logic, though sound, has many fundraising teams overly concerned about how they are perceived by their donors. They're wondering, why are prospects giving or not giving? What are the main concerns right now? What are their fears and doubts? If anxiety over questions like these is causing you not to pick up the phone or not to close gifts, then you're making one of the biggest fundraising mistakes of this COVID-19 crisis. Don't get stuck in your own anxiety about how you're going to be perceived by your donors and prospects, because this will paralyze you. The solution? Communicate honestly with your donors, but don't adjust your behavior until you receive feedback from them. It's okay that you're not sure how to approach your donors and prospects during this time. If you're feeling like this, be open and honest with your donors and prospects. They'll appreciate the fact that you're not 100% sure how to proceed at this point, because let's face it, they're probably not sure either. Here's how you can approach this kind of conversation. Hey, Mr. Prospect, I know this is a crazy time right now. I want to be sensitive to your needs. If you need help, or if you need me to be quiet, I'm happy to adjust, and I'm happy not to reach out for a while. I just wanted to reach out today to see how you're doing and what I can do to help. And if you still want to consider making a gift to support us and our efforts, is making a philanthropic gift right now going to help you or make you feel better about the situation you're in? Just make sure you're talking and taking in whatever feedback your prospects give you. Then you can adjust accordingly and keep asking and keep soliciting. Keep on promoting generosity and asking for support for your mission. As I said, it's a mistake to assume your prospects aren't going to give. Here's something I keep hearing. I don't want to push this gift because I'm not sure if it's a good time for them to give right now. Yes, we're in the middle of a global pandemic. Yes, things are probably going to get worse before they get better. But remember, this is not the time to crawl into a hole and wait for someone to tell you that it's okay to start fundraising again. Right now, businesses are still running. Fundraising offices are still running. Major gifts are still being made. We're still closing big gifts right now, and you can too. The solution: find ways that you and your healthcare organization or your mission can help people through these times. Don't be so worried about annoying someone that you stop serving your prospects and your donors. In fact, your services, your fundraising might be able to help your donors through this difficult time. Maybe you can offer them an opportunity that helps, and that keeps them focused on the good, on the better. Whatever you're proposing support for, find a way that you make it relevant and useful to your donors right now during this crisis. Here's the key. When you reach out, don't pretend everything is great. Acknowledge this is a stressful time, but don't stop asking just because you think they might not give. We still have prospects in our pipeline that are interested in our mission, and I know you have those prospects in your pipeline. If you keep working your pipeline effectively and focus on serving your donors and prospects, you'll get through this. Here's my advice. Keep promoting generosity and asking for support. When you continue asking and building your support for your mission through this difficult time, it's good for your donors, it's good for your career, and it's good for your organization's mission. Not only that, continue soliciting and asking, and you'll be contributing to the recovery. You'll be contributing to the economy, and you'll be helping the world to continue to function through this pandemic. Keep promoting generosity and asking for support for your mission. Keep asking. Giving is inviting people to be a part of being connected, being a part of their community. It's a part of helping others with their needs. Don't think for a moment you can't ask for support. Your best donors, your prospects, even your leads right now need you more than ever. People may be confused how they can help. People don't know what the best options are for supporting your healthcare organization, so it's your role to help them. There are people out there that need to hear from you. Some may not know that they need to hear from you, and others may be waiting to hear from someone from the hospital fundraising office or healthcare organization philanthropy office. People are looking for information. This pandemic is a period of time that we may never see in our lifetime, so it's our duty to make the most of it. Fundraising should not be an afterthought. Fundraising is a leading thought. Make it your mission today and every day to be helping and supporting and soliciting others to help those in need. And keep on thinking ahead. This can be a moment for strategic and long-term planning. Examples could include updating budgets or timelines or prospect management plans or other planning documents you plan to use going forward in your work. This is a time to establish or reestablish and update your metrics and your goals and ways that you're going to track progress. This may be a time to be reading about your health system, your hospital, your care organization, and the programs and the unit level strategic plans and communications that they have put out. And that can help you determine the possibilities for your fundraising activities and align with fundraising with their plans. Consider ways that you can improve your efforts and work in your environment. Think about the long-term recoveries and your long-term goals. Keep discovering your own personal motivators. Start to understand what drives you. The words motivation and emotion both come from the Latin word motus, meaning movement, impulse, or passion. What chimes with your personality? Is it curiosity, problem solving, the chance to learn, a sense of achievement, or proving meaning or taking an interest? It depends on the task, but try to apply some of these motivators, the things that motivate you, and set yourself deadlines. This is a great way to keep on task. If your prospect management plans or your projects are long-term, break them down into smaller tasks with a deadline for each one. Know what motivates you and capitalize on those motivators. And keep on understanding the good versus bad anxiety. Some anxiety is productive. It's what motivates us to wash our hands often and distance ourselves from others when there's an important reason to do so. But unproductive anxiety can make our minds spin in all kinds of frightening directions. Consider the good anxiety. Good anxiety is designed to focus our attention and fuel action to solve issues and problems. It's not designed to be ignored, which means that we can use good anxiety to help us accomplish our goals. Use it to our advantage. The key is to be open to our good anxiety, to listen to its message, and to not resist or fear it, because this only escalates the bad anxiety and makes it less useful to us. So keep focusing on the present. Staying grounded in the present prevents our anxiety from spinning stories about the future, like worrying excessively that you or someone you love will become fatally ill. And be aware of distress reactions. Trouble sleeping, difficulty concentrating, and a sense of being unsafe are all signs that someone is experiencing a distress reaction. Stay present. Remain conscious of your thoughts. Try to keep your thoughts positive and present focused. If you find yourself going down a negative train of thought or worrying about the future, shift your focus back to positive thoughts and about the here and now. Focus your mind on your present situation and take time each day to think about only what's going on right there in the moment. Keep moving around. Keep moving forward. Movement helps tremendously. Get up, dance, move around, air guitar to your favorite song, go outside, fold the laundry, shovel snow. Remember, we professional fundraising leaders and major gift officers are very used to structured activity at work and even at home, and we like it with social interaction. We need and crave motion and activity. So take breaks and move. Dance with your significant other or your pet or your child. Just keep on moving. Keep on focusing on nutrition. When we take good care of our bodies, we optimize our ability to think clearly, to solve problems, to manage our emotion. Healthy habits that you can control help you deal with this pandemic-created stress and crisis. Practice good sleep hygiene. Allow yourself enough time to get adequate sleep each night and create an environment that promotes rest. Avoid habits that can adversely affect your quality of sleep. Stay active. Exercise is a key to maintaining a healthy mindset. Try to start each day by getting fresh air and exercise if possible. And eat high quality foods that contain vitamins and minerals and antioxidants that help nourish the brain and protect us against oxidative stress. Eat right and regularly, and be sure to stay hydrated. Keep focusing on the positive and what has not changed. A March article in Psychology Today by Dr. Elizabeth Cohen talked about this philosophy. She suggested to readers to look around and list 3 things that have not changed since this pandemic crisis. Are the birds still arriving at your backyard feeder? Are your kids still asking you to bring them a snack? Mine are. Are you blessed to help a child or a grandchild solve a homework problem? Are you still getting tweets and Facebook updates from your friends and on your phone? Focus on the positive and what is staying the same. Do what you can to keep your daily routines. And keep on remembering to laugh. There is mounting data to support the positive impact that laughter has on our health, both in the short term and the long term. Laughter is good medicine. Conversely, being grumpy is bad medicine. Since ancient times, people have understood the connection between a happy, jovial heart and good health. Studies show that laughter and a good sense of humor can literally ward off and at least diminish disease. Laughter induces physical changes in your body, including stimulating your organs. Laughter enhances the body's intake of oxygen, thus stimulating your heart and your lungs and your muscles. It increases endorphins that are released by your brain. When you keep activating and relieving stress through laughter, you are increasing your heart rate and lowering your blood pressure. A good laugh stimulates circulation and promotes muscle relaxation. Both are essential for reducing physical symptoms of stress. When possible and appropriate, try to share a laugh or a light moment with a coworker or with a donor or with a prospective donor or a friend or a loved one. And keep staying connected to your loved ones. When social distancing requires physical separation from others, stay close by using FaceTime or phone calls or Zoom or texting photos or making cards and projects and putting them in the mail. This pandemic has created unique challenges for families hoping to stay in touch with vulnerable loved ones. We learned that during Thanksgiving. Those who are 65 and older or who live in assisted living or senior care facilities, well, they're listed as high risk for the virus. For most families, keeping senior loved ones safe from infection means foregoing in-person visits or finding other ways to create some form of connection. So take advantage of the tools like FaceTime and Skype and Zoom and GoToMeeting and WhatsApp. Communicate via video calls. And remember, snail mail is still important. The good old-fashioned mail is still an option, and it can give anyone, a donor, a prospect, a coworker, a family member, an emotional lift to get a card or a letter or a gift or a package in the mail. And don't forget a good old-fashioned phone call. That still works too. Pick up the phone and dial. As social distancing continues its many ways, it's more important than ever to connect with our donors, our prospects, our coworkers, our loved ones. Stay in the loop on their lives and keep on preventing the feelings of isolation. We may not be together physically, but we can keep on making connections, and it's vital that we do this on a regular basis. Keep on showing love for your community. Look for community initiatives that reflect your values and think about contributing. Follow the guidelines in your area for social distancing. But maybe it's volunteering for your own healthcare organization, or it's volunteering to drop off food or supplies to an elderly neighbor or a family with very young children. Shop and drop. Many people can't get to stores or pharmacies right now, either due to illness or the fact that they're trying to avoid getting sick. Try shopping for them and dropping at their front door. Share resources. Consider making a donation of your own to a local church, to a food bank, or to your own healthcare nonprofit. These organizations we know are actively reaching out to families who are in need, so let's help them. Keep showing love for your community. And don't hesitate to share great ideas for keeping busy and entertained with others. Thank the workers on the front lines. There are many people who are working on the front lines right now during this coronavirus crisis. People like our colleague healthcare workers, or firemen, or police, or grocery store workers. That just names a few. They're working to keep us safe and healthy and keep our communities going. They are working long, exhausting hours and are putting themselves at risk. If you see one of these people out on the front lines, make sure to stop and thank them for all their hard work and dedication. They don't hear it enough. Be positively and safely active in your community where you can. Keep creating celebrations and acknowledging your gratitude. During a crisis, fear can take over, as we said, and our perspectives narrow. But keep thinking about what makes you feel grateful these days. All of us are disappointed by the cancellation of upcoming fundraising events, or our spring fundraisers, and now our fall end-of-year fundraisers, our donor recognition gatherings. And personally, we may be affected by canceled school band concerts, or holiday dance competitions, or birthday parties, or major vacations and holiday celebrations with families and friends. Create excitement and anticipation by planning a fun virtual meetup or event. The planning of and the preparation of an event like this is often more fun than the actual event. These events do not need to be elaborate or cost a lot of money. Maybe declare next Friday a thank you morning, or schedule video meetings with your best donors and advocates just to share good ideas and good stories about how they're preparing for the holidays. Being mindfully grateful in real time of all the people working together under these taxing circumstances is what's important. We all have much to be grateful for, even today. And keep on taking breaks and giving yourself a timeout. Quarantine can be monotonous. Whether you're wearing a path from your kitchen to your living room or participating in your 10th video conference of the week, be sure to take breaks so your brain can recharge. One psychology study found that breaks contributed to a reduction in exhaustion and an increase in energy and vigor. So find ways to get away, even if it's for brief moments, to look out the window or to get a fresh breath on your back porch. If you feel overwhelmed, stressed, tired, or you're reaching your Zoom limit, remove yourself from the situation. Be safe and take a few moments to calm yourself down. Take a shower, walk outside, take the dog for a walk, vacuum, lie on your bed in the dark and meditate. Email coworkers in your fundraising office, or a mentor in the healthcare philanthropy industry, or just call a friend. Or do what my daughters and I do. Watch a silly YouTube or TikTok video and laugh. Just recharge and start again. Take breaks and give yourself a timeout every once in a while. Keep making high-risk activities as short as possible. Every time you make plans, ask yourself, if an infected person happens to be nearby, how much time could I be spending with them? It takes an extended period of close contact with an infected person, or an extended time in a poorly ventilated room, with an infected person to have a substantial risk of catching the virus through the air. When making decisions, keep indoor events brief and move social events outdoors if possible, and wear a mask and social distance. Limit your exposure and keep on taking pandemic precautions. Keep being that trusted source of information in this crisis for your prospects and donors. We know that false and fake and misinformation are already spreading like wildfire over the internet in normal times, but even more so in these times. And it's no surprise, some of the most outlandish, flat earth theories about the pandemic are out there, and they continue to multiply. In a world where Facebook and television feels real, and a story shown on a screen in our living room seems closer than it actually is, we need trusted sources. So make your organization a trusted voice in the healthcare field. Be the go-to resource with solid information for your donors and prospects and coworkers and friends. My prediction is that your organization and its fundraising will recover in a far stronger reputational position if you're known as a trusted source of information during this crisis and how to get through it. This also means that you have to keep on staying informed and being level-headed yourself. Keeping yourself updated on the events taking place within your healthcare organization and in your city and in your locality and in your state and in the world, all due to the coronavirus pandemic. This will help you understand the importance of the ongoing issues and how to deal with them, and it'll help you communicate with your prospects and your donors. Try finding and understanding everything that is helping your healthcare organization. Talk to other healthcare fundraisers about what they're doing successfully. Look for what kind of donors are supporting relief funds and at what level gifts are coming in. And look to understand how this disease is evolving and its effect on you and your organization and your caregivers, your donors and your prospects and others in your community. Stay informed and be level-headed. And I said it before, but it's important enough to say again. Keep practicing gratitude. This year, especially, take time to account for all the things you're grateful for. Set aside a few minutes each day to jot down the things that you're grateful for. It's a proven method to improve mood and to increase generosity. Gratitude is a practice, it's a mindset, it's an approach. Even if your coworkers or your donors or your friends or your family remain far away this year, you can remind yourselves of all the good things that truly matter and perhaps create some clarity throughout this turbulence. Focus on the silver linings. Count your blessings. Stop to smell the roses, as they say. These aren't just cliches. They're activities that research shows can enhance your quality of life. The health benefits of practicing gratitude are wide-ranging. Practicing gratitude can be easy, it can be rewarding, and it can be fun. Keep prioritizing meaningful relationships. Loneliness has surely hit us all this year. Virtual is wonderful, but I think we all want to talk to someone in person. We all want to give people hugs. What if, though, this were the ideal time to step back and evaluate those relationships in your lives? Maybe we need to take more time thinking about our donors and our coworkers and our prospects and our parents and our kids. If you're feeling uncomfortable, the other person who's missing you may also be uncomfortable too. If you're feeling lonely and unsettled, think about others who are lonely and unsettled. This is a time to connect and prioritize meaningful relationships in your life. It's also a time to have great faith in humanity. I'm not going to lie, my faith in humanity was at an all-time low during this pandemic. Maybe it was the election, or maybe it was the crazy conversations that my uncle was having on Facebook and some of the posts that he was making. Today, so many people are untrustworthy. They're pointing fingers, they're bickering, they're spewing hate. Unfortunately, we've let this bleed into every aspect of our lives. But I believe, though, that this pandemic has awakened our compassion and our understanding. Many, many people have stepped up to the plate for those in need, regardless of their beliefs and regardless of their politics. I hope this newfound camaraderie transcends this time of crisis, and we continue to have great faith in humanity. I also know that means we have to keep asking open questions to understand. When emotions run high, our default is to become defensive or judgmental, blaming and shaming people, without even intending really to do so. It just happens. We shut down. We think only who is right and who is wrong. No one wants to be wrong, so we push to ensure we will be right thinking, and that makes us feel better. And as we push to make our opinion known and considered right, we close down the conversation, eliminating the possibility of expanding the train of thought. This process can be and is very destructive. It creates misunderstandings, and it limits opportunities, and it limits innovation. The key to challenging moments and dealing with conflict is curiosity. It helps us stay calm. It helps us seek clarity. It helps us focus to understand and to be open and explore and discover other possibilities. All of these contribute to finding common ground upon which to develop new opportunities. So asking open questions, who, what, where, when, how, allows us to stay open and curious, to learn what is going on rather than to slip into a defensive mode where we are judgmental and blaming and even shaming. And that shuts down the opportunities and relationships, and it always leads to conflict. So we need to ask questions, find questions. Not only will this make us feel good, but it helps us connect, and it helps us connect between our heart and our brain, and that leads to a greater sense of openness. So when we find ourselves getting emotional or activating anger, stop and ask questions and actively listen. As you keep asking open questions and actively listening to learn, you will notice your emotions start to dissipate, and you will be able to stay connected and calm in any situation. And lastly, as I start to conclude here, keep on being kind and seeing this crazy time as a gift. Think of others, not yourself. When individuals' very existence is threatened, they tend to turn inward and become more tribal or more xenophobic and less compassionate than ever. If you can, perhaps it's time to take a break from the me first reflex that we all face or have during this pandemic time. I'm not suggesting that you stop taking care of yourself or your family, but rather expand your definition of family to the person down the hall or across town or across the neighborhood. Keep on being kind and seeing this crazy time as a gift. The days are long and the years are short. The unique time will be over more quickly than we realize. So be kind during this epidemic. That's truly how we find our way forward. The most important thing you can do is be kind. Be kind to every race, every religion, every gender, every sexual orientation. This is not a time to point fingers, to be racist, to be judgmental, to be political, or to be greedy. Rather, a time right now is for everyone to come together and help each other. When you are kind and caring to those around you, you will automatically feel calm and feel happy. So in summary, thanks for being with us today. There's no real way around it. This year has been terrifying, it's been exhausting, and generally horrible, to the extent that there's almost no solace, and we're not sure when it's going to end, but we can see victory on the horizon, if you will. To top it all off, we're now about to enter the end of the year holiday season, when the things we typically associate this time of year with, office parties, cookie exchanges, traveling, gift giving, celebration with relatives, they're all not allowed, or fear or worsening that there's going to be a terrible swell of COVID-19 cases across the country for those that do gather. So we need to keep calm and carry on. We need to let go. We need to move. We need to focus on the positive, stay connected, love our community, Give ourselves time. Stay informed. Be level-headed. Be calm. And keep calm and carry on as we settle into the new normal. The way we find our way forward is by keeping calm and carrying on. Successful gift officers are thinking laterally and looking well ahead over the horizon. They understand there will be at least 3 phases of this pandemic. There's the now, there's the recovery, and then there's the new normal. And successful gift officers are thinking about all of those today. So keep calm, carry on. Try to stay positive during a time like this by following and understanding what we shared today. Hopefully you'll carry on and you'll overcome this pandemic in a calm and efficient manner. Find your way forward. I thank you. And thank you again for being a part of today's Health Philanthropy Summit. I really thank Jennifer Wood, my colleague, for all of her work in producing today. And I thank all of you, our clients and our friends, for being a part of this. Please don't hesitate to reach out to us and let us know how we can help you. Health Giving prides itself at being 100% of healthcare 100% of the time. Let us partner with you to help create healthy philanthropic results. Again, thank you.